Well, we just want to say on behalf of the church, we are thankful that you would share some information with us and are glad to kind of have your wisdom and expertise on this matter. And thank you to Terry for setting this up.
And thank you to Wally.
It's absolutely my pleasure. And it's kind of a serendipitous path that led me to gathering information on the vaccine. Aside from being a physician and aside from being a citizen that could get COVID, I just found myself in, I guess, in alignment with some information and some people that had questions. And I realized every time I opened my mouth to speak about this, people were interested. And then suddenly firefighter captains were calling me to speak to their crew. And there's a couple compelling things about this. Number one, I like education. I love education. Number two, this vaccine itself is really cool. And that's just not coming from a nerdy scientist. I think you'll find at the end of this, when we learn more about it, how compelling this situation is. I mean, this is 90%, 95% effective. We don't have anything like that in medicine. And that's just such an anomaly. And I'll go through the biochemistry and how we ended up with this number and all the people involved. But it's really a fun, it's a fun history. Well, actually not so fun. We'll go back to polio, and that wasn't fun at all, which is kind of what got me and my wife interested in learning more about this. So I'm kind of getting ahead of myself. And the other day, after I'd done this talk a few times, I thought, I don't even know the derivation of the word vaccine, where that came from. I mean, I know the definition of it, but the derivation of it is interesting in and of itself. So it comes from vaccina, which is the medical name for the smallpox disease back in the 1700s. So I dug a little deeper in that. And so cowpox was, it was treated successfully by a physician named Dr. Jenner. And perhaps you know this, I knew a bit of it, but I didn't know the details of this. He noticed back in the 1700s that milkmaids would get these pustules on their hands and they would get cowpox disease. But he noticed every year when the smallpox came through their communities, the milkmaids were the only people that didn't get smallpox. So he assumed that the two are related. And then he jumped into his scientific study, which involved taking a 8-year-old boy and a milkmaid, and he actually removed the pus from one of the lesions on the milkmaid's forearm, created a lesion in this 8-year-old boy's arm, and put the pus into the 8-year-old boy's arm. And then furthermore, 6 weeks later, exposed that 8-year-old boy to smallpox. And he didn't get smallpox. So that was really the first vaccination of vaccinia, and that's where the name comes from. So, a couple things spin off of that story. Number one is why we have medical review boards. Number two, I'd like to investigate the story of all of his family pets and maybe other children that didn't, he's not batting 100, I don't think. I suspect he had a few errors initially. So I think the whole history of this vaccine in particular, with our backdrop of polio, with vaccinia, is really compelling. So that wasn't the start of what got me into this. Actually, my wife and I were listening to a podcast as the pandemic started almost a year ago now. And that was really about it was initially about Pollock that developed the polio vaccine. And he, Falk and others did about 4 to 5 years of research, which is a typical timeline for a vaccination. And they came to market with a vaccine that was effective for a really brutal disease. Some of you perhaps can remember it. I know Bay Cliff had a polio clinic up until about 40 years ago. So polio is a horrible disease. It got attention because it was disfiguring and it affected children, and it was just bad for so many reasons. But what I learned in this podcast and subsequent research is that they came to market with a really effective vaccine for this. And we were not at all ready, despite a long rollout, to distribute it. And I came across this information both with the polio podcast, but I was also doing research on a really powerful woman who is named Hobby, Oretta Hobby, and she was the first secretary, the first female secretary of the Health, Education, and Welfare Department for the government. And so obviously this was 1951-ish, and she was responsible for the rollout of the polio vaccine, which should have been a glorious time. I've been involved with the COVID clinics in Marquette, and they're really fun with the positive energy. It's a privilege to be a part of it. We'll go back to 1951. Half the people in the government at that point felt like the government should pay for this and it would be free for everybody, and let's put an end to this. This is really affecting society and children, and it's having a huge impact on life. And the other half, including Secretary Hobby, felt that that would be a backdoor to socialized medicine, and they wanted nothing to do with it. So unfortunately, for a lot of people, that did not win out. And the government stepped back and said, all right, states, here's the vaccine, deal with it. And it really took about a year for local governments to figure out how to do distribution and then get the ball up and rolling. So 4 years of hard research, a year and a half to figure out distribution, 5.5 years, and we're dealing with polio vaccines. So that, in contrast to where we are with this vaccine that came out so quickly, and we're stumbling a bit with the distribution, but nothing like we did in 1951. The second aspect that got me interested in this was that the psychosocial aspect of this. I just couldn't believe, I'll get to the science next, but I couldn't believe with this really cool scientific process that there was negative information out there. I couldn't believe it wasn't 100% enthusiasm related to putting an end to this tough year for a lot of people. And I did a couple of things. I did some Google searches. The research I did was on scientific journals, but I stepped back and let Siri and Google feed me some information. And I realized a couple of things. My responses, the information generated by my searches would really depend upon whose computer I was. So Siri was fashioning information for me related to my previous Google searches, which is kind of creepy to me. So that, it knows I'm a scientist. It was giving me scientific information. I went on other people's computers and they got, some of the false rumors about the vaccine. And for one example, last week, I pulled up one on somebody else's computer, and it was on a US news source that said a Chinese scientist reviewed Norwegian literature and said nobody should get the vaccine. Oh. So, the first thing you do is start checking references, and the scientist wanted to be unnamed, a Chinese scientist, and then the Norwegian literature jumped into that and had to go beyond what was provided by the news source and get to the Norwegian literature. And they were right up front said that, they had a high mortality rate in this study. 23 patients died of COVID, or died in the study. They were incredibly frail, 90-plus-year-old people, and actually the death rate within the study was less than the predicted death rate for that population. So the Norwegians did nothing with that study. The Chinese scientists gave it to US news source, and that populates the airway. So I can understand some of the ambiguity or mistrust related to the vaccine, because there's just so much information out there, and who do you trust? I think the other thing that created some concern was the unfortunate name of the whole project. Operation Warp Speed, in my mind, does not instill confidence. I think the scientists involved, including competitive pharmaceuticals and competitive scientists, all got together publicly and stated they would not be bullied. They would not push the timeline. This was hard science, and instilled hopefully some confidence in some people. I think the other thing that I find compelling is the history of the anti-vaxxers. And at first, as a scientist, I just couldn't believe that even existed. But then, you can't base judgment until you walk a mile in other people's shoes. So I dug back into even the polio vaccine, and the polio vaccine, like all other vaccines until where we are essentially right now, involves taking the offensive particle, the polio virus, and doing what's called attenuation to it. So the virus is beat up or manipulated somehow such that hopefully it's not infectious. Then you inject that into the patient and the immune system recognizes that virus and creates the antibodies and you're immune from it. Well, during the botched rollout of the polio pandemic back in 1951, there was a relatively large batch that unfortunately did not get attenuated. And they injected hundreds of children with live polio virus and they got polio.
Oh.
So I can understand where in that era where the anti-vaxxer movement started. And then the other psychosocial aspect that really got my attention was how this pandemic became a political thing in the US. And I get it, and I can see where it came from, and it goes deeper than just the red and the blue states, wear a mask, that became a political statement. But even the term science had political implications, and it's not necessarily, the recent politics or the recent administration. I dug deeper on that, and that goes back to big tobacco in the 60s. And they did a fair amount of research into tobacco and nicotine and did determine that they were both addictive and carcinogenic, causes cancer, and buried that essentially. So those were scientists, obviously in the pocket of big tobacco, doing science, and they justified their outcomes through science. So I think the term science has lost credibility over the last 40 to 60 years. The anti-vaxxer movement's understandable. So that brings us to where we are now, to this really cool vaccine. And I think, and that brings me to where I am now, where I was learning all of this and having people coming to me with concerns. And I was surprised that there was such ambiguity about something that I thought was so cool and progressive. So, education's fun. And in this situation, I think very, very beneficial as well to get people on board. And it just takes a little bit of knowledge and about how the whole thing works to really get people on board and excited about it. I mean, that whole firehouse went from no way, no how to let's go, let's do this. So that's kind of how I ended up getting to the situation. And again, thank you for the privilege of sharing the little bit that I've learned. By history, I'm a retired orthopedic surgeon, and I'm sure that would create a lot of jokes in the medical community. Why an orthopod's up here, who doesn't even know how to use a stethoscope? And I'm talking about immunology, but I did go through medical school and do some more research. So back to Operation Warp Speed. How did within a year we get this really cool, progressive, very effective vaccine online? And it's really the result of quite a few things. About 10 years ago, started at the University of Wisconsin, went out to Penn. I got on Bill Gates' radar and others on working on this mRNA vaccine. Bill Gates and Melinda Gates were interested in world health, particularly rural world health. And they were very, very philanthropic and generous with their money. And it's a bit ironic that one of the conspiracy theories involves, this benefiting Bill and Melinda Gates when they've put hundreds of billions of dollars into this. So part of the reason we're up to speed here is that philanthropic people like the Gates and others have been putting a lot of money for a lot of time into just this situation, working with an mRNA virus. There has been previous research on mRNA viruses, the SARS and the Zika and Ebola and cytomegalovirus all have had some work with mRNA viruses. And I'll explain what mRNA is, and we'll get into biochemistry and we'll make it user-friendly, hopefully. So previous research helped. Collaboration with scientists around the world. And that comes in the form of scientists working together, not for profit. They realized early on that this is a world pandemic. One person is not going to be the hero here. We're going to have to work together. I like saying in life, we're all better together, but certainly in science, we're better together. And that was proven by the multiple scientists and laboratories and pharmacies that got together and shared information, which is unusual. Why won't that happen here forward? I don't know. I did hear an interesting talk with some people from CDC, and they thought this is a one and done. It's not going to happen again, but thankfully it did happen with this. And then collaboration also, the Chinese, they've been denigrated through this whole process, but really we're very fortunate that early on in this scenario, the most important thing was getting the DNA sequence of this virus, the actual medical chemical code of what this thing is. And that allows us to create some weaponry for it. And I'll get into how that worked. But to be 3 weeks into the pandemic and have the whole genetic sequencing of the virus, we're out of the gate running. That was critical. And that could have been a year process. And then the study started, and we all know a little bit about this. There's phase 1, which is a few number of people, phase 2, which is more people, and then phase 3, which is tens of thousands of people, to see if this works, if it's preventative for the virus, and more importantly, if there are serious side effects. And it looked like it was going well enough in phase 1 that the scientists were given permission to dovetail phase 2 over phase 1. So phase 1 wasn't done, and they started phase 2. A bit of a risk, but it looked really optimistic at that point. And likewise, when phase 2 was about halfway done, they jumped in with tens of thousands of people and started phase 3. And then furthermore, phase 3 looked to be so effective that the pharmacies and the governments started throwing billions of dollars into production of this vaccine just in case it worked at phase 3. So if phase 3 looked bad, they were billions and billions of dollars deep into this, and it was a gamble, but unfortunately that paid off. I don't know if you remember, partway through phase 3, Moderna had a little bump where they had to pull back and pull out of the study because they had 172 serious side effects. And everybody thought, all right, this was too good to be true. Here it comes. Here's the bad news. And that's why they were 2 weeks behind Pfizer, because they had this little blip. Well, of the 172 people that did get seriously sick, 169 of them were actually in the placebo group. They actually didn't even get the vaccine, which just goes to show the tens of thousands of people get sick. But think of what would have happened if just by chance those 169 people were in the trial group. That would have pulled Moderna back for probably months. So it was a bit of luck and a lot of collaboration and a lot of well-funded studies prior to the start of this year. So that gets us to the biochemistry, and I've tried to, yeah, I'm sorry, I'm laughing. I've got my mother in the background, which is how I got Christy's number. So I had my 90-year-old mother helping me get on Zoom, which was interesting. So the biochemistry of this, you hear mRNA and DNA and RNA, and let me just try and break it down for you. And if this is too basic for some, I apologize, but it's good to review. So the whole molecule of a cell involves the nucleus, which is the brain center of a cell, and then all just the fluid in the cell that surrounds the nucleus, which is kind of the workhouse. And I've kind of made the analogy recently of a mall, like a shopping mall, market mall, which unfortunately is essentially empty, but we'll assume J.C. Penney's is the nucleus and they're still functional, and the rest of the atrium is empty. So within the J.C. Penney's is the nucleus, and the nucleus, I think a really good example of that is like a golf ball. If anybody's ever peeled the layers off a golf ball, inside those rubber bands are wound so tightly and they contain a lot of material. And that's really what the DNA double helix is like. It's just wound and wound on top of itself. And then when you want to have the nucleus make something, and what nucleuses do are make proteins. So if it's a pancreas, it makes insulin, and it unwinds the portion for the insulin molecule. And so it unwinds it in the golf ball within J.C. Penney and makes it's like a zipper, and the zipper unzips, and you have two halves of the zipper. And then the mRNA comes in and creates the other half of that zipper. And it's just a small section of the zipper. It doesn't, if the whole DNA goes all the way up the length of your driveway, it's only about 3 inches of that zipper. And that's the mRNA that's going to make a protein. So if you have the if you have the sequence for the coronavirus, that's a pretty long segment. There's a lot of DNA there. But what the researchers have done is just found the segment that creates that spike protein. Everybody's seen the molecule with a spike sticking up. So they got the mRNA created for just the spike protein. That's it, the outside shell with a spike. It has no viral particles for DNA. It has nothing. It has nothing that can cause COVID. It just has the spike protein on it. So they were able to create the mRNA segment that does the spike protein. So in a normal cell, the zipper unzips, the mRNA comes in and matches the zipper. The zipper goes back together for the nucleus on the golf ball, and then that little segment leaves JCPenney's and goes out into the atrium and finds what's called the ribosome. And the ribosome is like the factory. So that mRNA, the messenger RNA, goes to the factory, which is the ribosome, plugs in, and it makes, insulin, or it makes thyroid, or it makes a hair cell, or in this case, it makes the spike protein. And the really interesting thing about that is, if we give the human body this mRNA for the spike protein, one of the concerns was that it went into JCPenney's and became part of the genetic code. It doesn't even go into JCPenney's. It just goes out into the cytoplasm, the atrium of the mall, finds the factory, and then makes that spike protein. And then they were able to engineer a way that as soon as it makes the protein, boom, it gets digested. So that genetic material you've introduced, it's made the protein, and then it goes away. And then one of the other barriers they had to do was really goose that ribosome, that factory maker, so that it made not just one protein, one spike protein, but it made a whole bunch of spike proteins. So that now that the immune system sees the spike protein, then it's a foreign intruder, and that's where the antibodies are made, to just that spike protein. The other benefit of that is that other viruses, other coronaviruses, have that spike protein. So this may be effective against other, other diseases that come along that have the spike protein on them. And I mentioned a couple of them before, the cytomegalovirus and others. So it gooses the cell to make the spike protein. It gets digested, it goes away. If it's floating in the blood, it gets digested by the immune system. So it does its job, and then it leaves the factory. And it's pretty miraculous. And as stated by the studies, this is 95% effective in preventing serious infections and mortality. And again, in medicine, there's really nothing, even cataract surgery or did joint replacements. It would be a very bold statement to say you have a 95% chance of complete efficacy of what we're trying to do here. So to do this in a relatively benevolent fashion and have that kind of outcome, I think that's how I got excited about this. I knew those numbers, and I just couldn't believe there was opposition to it. And I don't fault the people that I interfaced with. They were doing the best we all can do, and they had misinformation. So that's what really motivated me to get up to speed on how this is created and how effective it is. It also has implications in cancer research. So as I stated, anything that makes a protein, if you can target, if a cancer cell makes a protein, you can target that messenger RNA that's creating the protein in the factory on the atrium of the mall, and you can direct the immune system to attack that cancer cell that's creating that protein. So the implications are great for this virus, but there are serious oncology implications as well as public health. I often get asked about contraindications, people that absolutely should not take this. And the only real absolute contraindication is the very few people that have an allergy to polysorbate. And what that is an emulsifier, it breaks down products. It's ubiquitous in household products. It's in shampoo, it's in cosmetics. And there are a few people that have anaphylactic reactions to that. And they're the only people really that are a complete contraindication. There are no studies as of yet. They're going on right now on people under the age of 16. So that's a relative contraindication if you're under 16, but it's looking like those studies are going to be completed pretty quickly, and that will hopefully enable this under 16 age group to get it. People often ask about pregnant females, and pregnant females are actually are at a high risk for not doing well if they get COVID. So risks versus benefits, they've deemed it a beneficial. The benefits outweigh the risks in a pregnant female getting the vaccine. So it is recommended that a pregnant female get the vaccine. Trying to review anything here in the history that I might have left off. Any questions related to the biochemistry or the production of the vaccine? Or any questions at all, really?
Are there any other mRNA vaccines at the moment, or is this the first one?
Certainly the first one at this scale. What I couldn't find, I know they were working on Ebola, and I don't know if Ebola just went away by by respecting the virus and social distancing, if you will, or if they, I believe this is the first one to be directly used on the public for vaccination, but I don't know the absolute answer to that. I know a lot of research was going on for Ebola for several years ago, but I think Ebola is a non-issue until a couple of weeks ago. We had a blip back up.
Thanks.
So the I'm sorry, the spike protein is formed with the help of the ribosome.
Right. All right.
And then it's the vaccine that digests the protein, and that makes the virus go away.
Oh, that's a really good question. Okay, so we'll back up. So the vaccine is the mRNA, the messenger RNA. It's the portion of the zipper that codes for the spike protein. So what the vaccine is the piece of zipper, the mRNA, surrounded by a little bit of a lipid so that it doesn't get digested. And it goes into the body and it goes into the atrium to the ribosome. So it's the messenger that tells the ribosome to make the spike protein. And once it's done its job, once it's told the body to make the spike protein, it gets digested. So the vaccine goes away, but then the body has created the spike protein, and then the body sees that this spike protein is not a native thing. It's foreign to the body. So the antibodies are formed to the spike protein that's the invader. Even though the body made it, it was deceived to make it because it had foreign mRNA to tell it to make it. So what goes away, the vaccine goes away, which is really just the mRNA telling the body to make something it doesn't really want to make. But it just has to do it once. And then the immune system sees that and says, that's not right, and then forms antibodies. And the antibodies are what fight the virus if you were exposed to COVID. Did that make sense?
So does that have any implication for the length of time that the vaccine is good for?
Yeah, that is certainly the $1 million question. And let me answer that. Well, I'm not sure I can answer it because I don't think we have the answer.
No, I don't.
But it brings up a couple other trains of thought that I didn't speak about. The other vaccinations, such as the flu vaccination, are really the best guess of what's going on, ironically, in China the spring or several months before our cold and flu season. They go to China and figure out what the virulent viruses are there and take the 4 of them and attenuate them and inject us with viruses. And every year they do that, and we're about 50. If we're 50% effective, we're pretty proud of ourselves for creating a decent vaccine. And again, we're at 95% with this, and not injecting live viruses. So it's more effective, but the concern is longevity. I think much like the flu vaccine, we're probably going to have annual boosters to remind the body that the spike protein is bad, and then perhaps even modify the spike protein, as we're already seeing some variants are not evading, but they're getting into the cells with perhaps maybe a slight modification of the spike protein. To talk about the variants, of the hundreds and hundreds of sequences of these ribonucleic acids, so there's 4 base pairs that are on a DNA and RNA segment, and just 7 of them have changed in this variant out of hundreds and hundreds of them. And that's enough to create the variant that it looks to be more virulent, meaning it causes worse illness, and certainly more contagious. So I think the answer to the question is the antibodies are going to be fleeting, 3 to 6 months, and boosters maybe annually, I think is what the early thoughts are.
That would help me understand why a friend of mine had COVID and was hospitalized for so very long, but yet now she's been out and she's been COVID negative for probably, I don't know, maybe close to 6 months, and she was able to get a vaccine because their concern is, am I correct in their concern would be that maybe her ability to her protection may be lagging after.
Yeah, that's another really interesting thing. I'll answer your question, but it's probably not related to the 6 months, to tell you the truth. The recommendation was made, even if you've had COVID, whenever you can, you get the vaccination. And that comes from information related to benchtop research, where they took, unfortunately, the US is lagging behind in this, both in terms of sequencing the virus variants, as well as doing benchtop studies. And what I'm trying to say here is that in the UK, they sat down and analyzed, they quantitated the antibodies generated by many patients that had had COVID. And the antibody levels varied a bit, but all of them were under the amount of antibodies produced by someone who was given the vaccine and hadn't had COVID. So you actually get this is one of the few times the laboratory does better than the human body, but one gets a better immune response from the vaccine than from actually having COVID.
Okay.
It does seem, and I don't have exact numbers on this, but it does seem that the people that have had COVID seem to respond to the injections a little bit more vigorously in terms of an immune response. I know my daughter, on both first and second injection, she did have COVID, and she had a rough couple of days afterwards. Excuse me. So the answer to your question is, I suspect your friend would have gotten the vaccine if he or she was available to receive it even a month or 2 after having COVID.
Oh, all right.
Yeah.
Do you think this is going to affect civilization for maybe centuries to come? Or will it be conquered enough to not make a difference in 10 years?
That's a really good question. A really bright friend of mine from medical school for years has said, whatever you can do, expose yourself. And this was 20 years ago, up through recently. Whatever you can do, expose yourself to viruses. Viruses are what's going to wipe out mankind. And, I'll tell a family story. My mother's in your congregation. Her father, my grandfather, when he was in grade school, 1918, was sick in school, walked home, didn't feel well on the way home, rested under a tree for quite a few hours, finally made it home, was home in bed with the 1918 flu, survived, went back to school. And after he got back to school 3 weeks later, half of his entire school had died of the flu. So, that was 100 plus years ago. And that was a virus, and we're still, we've had atomic warfare since then. We've been on the moon since then, and we're still concerned about viruses wiping out our population. So I think the answer to your question is we've got a long way to go to protect ourselves from viruses. However, this was a significant, use the lunar module, this is one step forward for mankind, for sure. Am I still going to expose myself to all the viruses I can? Yes. I mean, I'm concerned that, as Bill Gates and other much smarter people than I are, it's a serious situation. Bacteria we can deal with more effectively. Viruses, if you wanted to create a fighting machine, a virus is it. They have really little baggage. They're nimble on their feet. They randomly disintegrate and reorganize their genes just to see if they're more effective. And that's what we're seeing with these variants. They don't have a lot of DNA, but they break it up and jumble it around and reform themselves and see if they're better. And if they're better, they take off. And if they aren't, that segment dies and they do it again. And so we're going to have our laboratories busy keeping up with viruses because they're nimble and smart.
Thank you.
Wally, I had a question about the interaction that we have with others. I really appreciated the way that you gave a little bit of history about why anti-vaxxers, sort of why they feel the way they do or where that history came from. I appreciate that. And also, you touched on just the political nature of the situation that we're all in. And I think, I've had it happen to me. I'm sure maybe we all have. You're speaking with a friend who says, well, I'm not getting that vaccine. I'm going to wait until they've had it for a long time. And, then maybe I'll get it later. And you sort of have like 3 minutes in that interaction as a friend to say something. And it's so, because, the culture is so fragile right now, I guess I feel personally, I just sort of let that moment kind of go. So given that, all that you're telling us, which is fascinating and really interesting, but I wouldn't be able to repeat it to someone in 3 minutes. Like if you were gonna have like 3 bullet points to say for that opportunity, when you have, a moment to say to someone, I totally respect where you're coming from, but I'm going to get the vaccine, or I've had the vaccine, and did you know this, and this? Like,
right.
Is there like a commercial?
Yeah, and Chris, you raise a really good point. Is number one, identify with them. Don't just say you're being foolish. No, they have their thoughts for various reasons. So, I go back to the polio vaccination, and that's where the anti-vax in my mind started. I understand it. So the difference there is they were taking polio and injecting it into the body and hoping it saw it as an invader. This situation, there is actually no infectious particles going into your body. There's no COVID infectious material, just the spike protein. And that in and of itself is pretty compelling. There's no chance of getting COVID from the COVID virus or vaccine. So, identify the history. To digress here a little bit, the minorities in America have been the recipients of a lot of studies without their permission. So I can understand why they are not trusting of the medical community. Ironic that Johns Hopkins has been the leader this year in following this virus and giving daily updates, when in fact, Johns Hopkins has a very bad history of experimenting on their population. So I identify the concerns, but then the scientific aspect. If you can just say that the material that goes into your body has no COVID virus infectious particles, it's just the shell on the outside, and antibodies to that will protect you against COVID and other viruses that are encased in that shell.
Okay. I think that's a good quick summary, because might be in line at the grocery store or just in passing, and you just it's hard to know what to say and to take advantage of that opportunity.
And then I conclude with the flu vaccine. Everybody not everybody, but many line up with the flu vaccine, and that is a virus. It's 4 viruses, and you have a chance of getting the flu from that, but you have no chance of getting the flu from COVID from the COVID vaccine.
There's a really interesting, quite a long and quite involved article in the latest issue of the National Geographic it's all about viruses. A lot of it was way over my head, but still when I persisted and read the whole thing, and I feel like I really had a little bit better understanding, all different stuff than what you were telling us.
Oh,
But,
good.
you know, it's a lot of good information. First, the thing that struck me, I think probably first, or at least maybe the most, was the fact that a virus is not a living thing.
Right. It needs you to live.
Yeah.
That's, I said it's nimble. It's so nimble that it can't survive on its own. It has to get into a host. And truly, a successful virus from a virus perspective is one that compromises its host, but it doesn't kill its host. Because if it kills its host, it kills itself.
You know, we've heard people talk about getting false positives and everything. Can you explain a little bit about false positives and how they come about, and what you talked about the shell of the virus and, you know, that kind of thing. Can you explain that to us?
Well, it depends on the study, and the false positive rate is relatively low. What the study is looking for is there's two types of tests. The antibody test to see if you have had COVID. So that's a pretty accurate diagnostic study, because they need to see the antibodies for it to be a positive study. And so if they don't see it, then it's negative. So false negative would be higher there, because perhaps they missed an antibody that was there. But false positives, when you're looking for the antibody, that's a pretty accurate study. A false positive, if you're looking for the virus itself under a microscope, would be pretty low also, because you have to see it. Lack of seeing it doesn't mean it's a negative, but seeing it makes it positive. So I think the false positive rate on both antibody as well as the virus test are pretty darn low. False negatives is another story, but we'd rather have false negatives. Well, that's not true. If you're looking for immunity, you'd rather have the patient think that they are not immune, and they are. If you're looking for the virus, you want them to know if they are negative. So it's seeing the virus and or the antibodies under a microscope.
That would give you the positive.
Yeah. If you see it, yes, that's a positive. That's not a false positive, though. If you see the virus, it's positive.
Right.
Right. So that's why false positives are not that common, because you have to, if you see it, it's theoretically there, unless you have a laboratory that's dirty.
Perhaps what I should have been asking about is the false negatives then.
Right. Right. So that's a higher number, because it implies, to say something's negative means that you looked at all space available for the antibody or the virus, and you can't see all space, and or maybe the virus died during your process. So so that is a challenge. But it's with this vaccine and this virus, they have been relatively successful in getting those down compared to other illnesses. But that's part of science, is false negatives and false positives. So do you understand what the false part of it means? So if you have a false negative, it means your study said you did not have COVID, but you do have COVID.
Right.
Mm-hmm. Mm-hmm. So,
and then the other aspect that I didn't mention is we learned a lot early on, and we're still learning on the timing of the study related to the virus. Now there's 3 days in there or so where you're without symptoms and you're positive. And I know of many studies done locally where someone was checked 1 day and 3 days later they were positive. Were they positive the first time? The study was negative, but did they have the virus? We don't know.
mm-hmm.
I guess related to that, Is the rapid test as accurate as the, shall we say, more aggressive, deeper in the nose test?
Yeah, I don't have a statistical answer for you.
Okay.
The ELISA study, which was the 5-day study, was pretty darn accurate. The benchtop aspect of it was accurate. The problem was obtaining the sample, and it's noxious, and people withdraw and don't get to the right area. And that would be the false negative aspect of the ELISA study. And ELISA is a immunoassay where they use electrophoresis and look, it takes 5 days to do. We're not doing many of those studies now. But it's usually technical error rather than laboratory error for the false negatives.
Mhm. Mhm.
And many places have the patients swabbing themselves, which you know,
Yes.
it's really hard to do.
Yeah.
That's our son is a athlete at MSHS, and that's what they're doing, is having the kids swab.
Yeah.
Not good, huh?
Nobody wants to put themselves through self-torture.
No.
You know? So
No.
they're gonna draw away from that, I'm sure.
Oh, sure.
Yeah.
Yeah, I could do it. And when I was a general surgeon, passing nasogastric tubes through the nose, would make me tear up as much as the patient.
Mhm.
Yeah. So,
Mhm.
I know earlier, Wally, I had asked you a
Oh.
question and you said I had to tune in to find out.
Here we are. Here we are. The question that Terry asked me was, some people are taking anti-inflammatories as a prophylaxis against particularly the second injection, when in fact that's more likely when people are more likely to have symptoms. And anti-inflammatories are just that. They decrease inflammation, and inflammation is a part of the infectious process. So there is some theory out there that if you are suppressing the inflammation, you're suppressing the response to the vaccine. It's not proven, you know, we've never done the study. Someone takes an anti-inflammatory and look at how many antibodies they produce. That's not been done yet. It's more theoretic. And what I've read and what I've told patients in the clinic when I'm doing the injections is that for sure Tylenol is a great idea. Tylenol is an anti-fever medication. It's not an anti-inflammatory. Tylenol is very benevolent in the right doses. And if one is having a temperature, it's pretty effective in taking the temperature down. And by the way, a temperature is the first line of defense. When a body is getting an illness, the temperature goes up because it wants to create a situation where you're a less hospitable host for the virus. So if your body temperature is up, hopefully the virus won't like that and that will kill it. So the body temperature goes up when the immune system is getting kicked in. So when people have a temperature after they receive the vaccine, that's the immune system doing its job. You know, we know you can't get COVID from the vaccine, but I'm pleased when I hear somebody say I had a little bit of a temperature afterwards. I said, good, your body saw something it didn't like and you're responding appropriately. I had nothing with my vaccine. I hope I hope I get something. Careful what I wish for. So to answer the question, Tylenol for sure. And then what I've read and said to people is that if you are having really something pretty uncomfortable afterwards, where you are just aching and can't get off the couch and really can't get over it, then probably anti-inflammatories are justified. But short of that, I probably would not take an Advil or a Motrin anti-inflammatory of that magnitude.
Good to know.
Yeah.
Here's the next step to that question. What about people that are older and are probably prescribed things like Mobic and those kinds of things as a routine medication for themselves?
Yeah.
That's an anti-inflammatory as well, correct?
Yeah. And I said, well, I mean, to use that exact example, Mobic is one pill once a day. And if that patient were to come off for 2 or 3 days, they probably have a little bit of residual built up. There's no hard science on that. And I guess I would base it on the magnitude of their need for Mobic. But I would, if it were my patient and they felt like they could endure 3 days of no Mobic holiday, I would encourage them to do so. And then, if they had breakthrough pain that was uncontrollable, Mobic takes a while to kick in. I would just do an 8-hour Motrin and just get to it quickly and get off of it again. So off the Mobic, off the Mobic for a couple of days, and Motrin if they absolutely had to have it.
Are other prescribed anti-inflammatories pretty consistent with Mobic?
Well, the nice thing about Mobic, and I was going to add this, if you have if this is truly an example and your friend's coming off Mobic, Mobic is good in that it is less irritating to the stomach. So if your patient there is coming off Mobic and you're telling them to take Motrin, make sure they protect their stomach with food. So Mobic, you're asking to compare that to Aleve and others. Mobic's more GI friendly.
I see. Mm-hmm.
It's also nice that it's 24-hour acting and it's a tiny little pill.
Well, I heard that statement. The reason I asked that is because I heard it, or I saw it posted on Facebook, and of course you can't believe for sure what you hear on Facebook. So I thought, and I don't know if I've heard it broadcast on any news programs or any medical programs about not taking the anti-inflammatories. So I wondered what really we should be doing.
Yeah.
If you want to do it right,
There's no definitive studies on it, and it's a frequent, when I'm doing the clinics, it's a frequent question to patients that I'm asked. Yeah.
Okay. We kind of jumped into questions, but did you have more that you had wanted to share with us that was off?
Well, I could talk forever about science, particularly this vaccine, but I think we covered the main points.
Okay. Well, I think I'm going to get that article on from National Geographic. That sounds pretty good.
That does. Yeah.
As I said, it's pretty, a lot of it was over my head, but as I said, I got the general gist of a lot of things about viruses in themselves.
Yeah. So, well, one thing that I hadn't been clear about was I guess I was thinking that they were injecting a live virus and just enough to activate your body. So it's good to know that it is not a live virus.
Yeah, it's really interesting. And the past 10 years research was, they knew the concept, but they had to figure out how they were injecting RNA, mRNA, and it was being metabolized and digested immediately. So that's why they have this lipid shell around it so it can get to the place it needs to go. And there were quite a few obstacles to get this to work, and it all just came to fruition recently, right in time for this pandemic.
So looking to the future, is there research going on about things that might be in the offing? We don't know what, of course, but like it was for the coronavirus, there was a lot of research that had been ongoing.
Related to the mRNA aspect of it, or just to vaccines in general?
I guess I wasn't clear about that, but I know that it didn't just start from scratch 8 months ago.
Right. Yeah, and I thought it was interesting that the first study of mRNA into a living being, which was a mouse, happened in University of Wisconsin about 10 years ago. So I guess I'm not sure of the question, but I think related to the mRNA aspect, they're certainly going to do more work, as we're going to have to figure out these variants. But the next step also is oncology. There's just so many implications where we have proteins in our body that are not beneficial that this potentially could attack.
Boy, opens up a whole new world, huh?
Yeah.
Now these variants that have come up, what they all have those spike proteins, right? The COVID variants.
Yeah, that's
So
the corona.
theoretically.
That's the corona aspect, yes.
So theoretically, the mRNA vaccine should should handle all of those. That's why they're saying the vaccines that are out they're expecting should handle the variants.
The early research looks like the variants are more contagious because they're finding a better way or a different way to get into the cell. So the spike is really just the way for the virus to attach to a cell and get into it. And like I said, the virus then has to inject its DNA into the host cell, because the host cell, yours and my cells, are what create then the COVID virus. The virus itself can't do it. So the virus injects its DNA into our system, and our system starts cranking out more virus. So we've got to figure out how to prevent it from getting in the cell. And the variants right now, though they do have spike proteins, are figuring out a better way or a different way to get in. And like I said, only shifting 7 base pairs. So it's not a big modification from hundreds and thousands of base pairs. But we have our work cut out for us staying in front of a virus, because it is, like I said, very nimble and quick to mutate.
When we get both shots, we then are unable, I mean, we're not able, but we don't have to worry about being a carrier.
That question has not been answered either. My sister and her husband, who is a physician, were supposed to visit us this weekend. They both have had their injections, and they couldn't get an answer whether they could come up and be safe in our house or not. So early studies look like vaccinated people are likely not carriers, but no one's making a definitive statement yet.
Thank you.
Mm-hmm. I wish I could say yes to that.
Well, we know, we should still keep wearing our masks,
Yeah.
I was thinking, like, in a whole neighborhood, if everybody finally gets their shots, and so in a sense are cured, can we still translate it to somebody who hasn't had their shots? Will the germs die pretty quick? Since they're bouncing out of everybody, because we no longer can allow them to get detached to us or attached to us, then they ought to die fairly quickly, right?
Well, I think what we found early on is that it doesn't survive very long on surfaces. So if you are truly out in the community or outside in your neighborhood, I don't think there's been a documented case of transmission in the outdoors with people 6 feet apart. People are being denigrated currently by, running outside without a mask on. But again, there's not been described transmission outdoors with people social distancing. So with the vaccine and outdoors, I think you can be pretty comfortable that you're not going to transmit it to others. It doesn't live on surfaces very long, which is comforting. With all the hand washing we were doing earlier, it's still important, but you don't have to worry about, the grocery store would have been a horrible situation had that, the avocados would have all been contagious. But it's aerosolized, it's in the air. And if you're not directly breathing someone's breath, then you're pretty safe.
Okay.
We're in the process of trying to determine when we're going to come back to worship, and that's a hard one to decide, because there's so many variables to it. Sitting apart, people wearing masks, people not wearing masks, singing,
Yes.
that kind of thing. I have one more question, and then maybe we should wrap it up, because we've had a good response to this and lots of questions. But Wally, you are giving injections. Are you doing that through the health department, or are you giving them? How are you involved in that? And what's your take on how quickly and how well we're doing, in Marquette, and are we getting shipments?
Yeah. The answer, I'm working through the hospital.
Okay.
But I love the collaboration that is going on between the hospital and the health department. One example is they were trying to be consistent with care providers getting one vaccine, it happened to be Pfizer, and the educators getting another one, which is Moderna. And when you have two different groups providing the vaccines, the hospitals and the care facilities were going back and forth and sharing vaccines and exchanging with each other. So there's been excellent collaboration with each group. The other thing I've been very proud of, that serendipitously, is that they've been effective in getting it into the arm, so to speak. I've joked with my friends that probably the most unethical thing I ever considered in medicine is I'm sitting there with a pile of 14 and 15 syringes in front of me all day long. And I have friends who are medically compromised who are not able to get their shots for various reasons. And I thought about pocketing one or two. I didn't, obviously, but so at the end of the day, I said to the pharmacist, as he and she came around to replenish my supply, I said, at the end of the day, do you have like a short list of people you can call if you have some left and the patients don't show? And at that point, she proudly said to me, they're about 6 weeks deep into the clinic, and they said, we have not wasted one vaccine. So as the day starts to wind down, they only draw up and aspirate a syringe per patient. So they've been very effective in utilizing all their vaccines and zero wasting, which is excellent. And that's unusual. And Marquette County at that point also was at 10.5% percentage populace with the vaccine, which was double the state average at that point. State's 4.5. So Marquette County is doing a great job of getting it into the patients and not wasting it. And part of that is through the collaboration with the health department. Great.
Are we getting shipments pretty consistently, or are we waiting?
It's been Gar, the CEO of the hospital, I asked him that 2 weeks ago, and he said, I'd love to have more. I can't complain, because that's when he told me about the percentage that we've done here. So we are getting it, not as much as they'd like. They have a longer list, but I think we're getting it proportionally better than most.
That's great.
Yeah.
Great. So.
Which brings me to think about, they're talking about third world countries and places that have not been able to get the vaccines yet. Are there plans to make sure that those people do too? Because we need a worldwide herd immunity.
Yeah, there's so many challenges. California has not done a great job at getting the vaccines and people, because they've been stumbling over equity. And that's not a judgment statement. And I understand where that's coming from, but just with the concern of equity into minorities and to less privileged people, that they ended up wasting a fair amount of vaccines. So related to the third world countries, I think that they're waiting on AstraZeneca and Johnson & Johnson, because they're single injections and they don't require sub-zero accommodations or storage. So I think it's coming, but again, it's going to be a challenge to get it to the periphery of the world. And the other challenge is, as we drag our heels, these viruses are mutating and becoming a bit resistant, and they appear to be more resistant to the J&J and AstraZeneca than they are to the Pfizer and Moderna. To get more technical, the J&J and the AstraZeneca are what are called vector RNA viruses. So they actually have a little bit more DNA with them. They have a virus vector that the mRNA attaches to, which might be the reason why they're more stable and don't require the sub-zero freezing. But the initial thought was, if they get the J&J and they're becoming symptomatic again, then give AstraZeneca, but that won't work, because you have antibodies formed to that little messenger, that vector, if you will, because they're both using vectors. So you can't give both J&J and AstraZeneca. So there are some challenges with the third world situation that go beyond just the demographics and the geography.
Well, the others give 2 shots, and the J&J and the AstraZeneca only are the 1 shot, correct?
I believe that's true, yes.
Okay.
I know
And
J&J is a single.
does it seem like it's not potent enough? You know?
Well, it's most of science happens by mistakes and serendipity. To get more detailed on the Moderna study, I don't know if you remember that they came out in the phase 3 portion and said that they had a 72 and 95% efficacy. And people were wondering, how did you have 2 levels of efficacy? And what happened was, in a small subset of population in the UK and Britain, someone erroneously only gave half of the first dose to their patients. And then on the second dose, they got the full vaccine. And everybody said, well, oh my gosh, what are we going to do? And then they studied those patients, and they were the ones that were 95% effective. So by giving half of the first dose and all of the second dose, they created more immunity than if they had done it by convention. And that was a complete mistake. And they didn't have high enough numbers to say, all right, that's going to be the protocol. That's how we're going to do it. But that just goes to show that, this phase 3 studies are exactly what we're doing right now. And that's what we know. But we also probably know if we went 6 weeks, it might be better. Or if we gave half the first dose, it might be better. But we don't have definitive answers on those. And we can only deal with science in phase 3 studies. So, perhaps we would get equal immunity with 1 shot, but we haven't studied that.
All right, one last question. Does anyone have any question? Well, this has been, whoops, what, Carol?
I just have a comment. When you were talking about the polio virus or polio vaccine, I was like 9 years old during that period of time, 9 or 10. And I remember going with my mother to the savings bank building where I guess the health department was doing the first vaccines, at least the first ones that we got. So that was kind of, I remember exactly doing it. I don't know why that would stick with me, but it did.
So that was the savings building in Marquette?
Yeah.
So down in the base, Dr. Pilati had an office in there, I believe.
Oh no, this was long before Dr.
Yeah.
I don't know. I don't know where it was in that building. My memory isn't quite that good. But I remember going upstairs, so it must have been not in maybe the health department was housed in there at some point. I'm not sure. But anyway, just
we had ours in school.
Yeah.
The very first one was in school. I remember that because Peter Kelly had polio, so we were all so excited to get the shot.
Well, it's certainly, it's memory producing, that's for sure. So, Wally, thank you so very, very much for taking the time to share all of your knowledge with us and answer our questions. I think it's been very helpful and very informing. I'm pleased that you would do that. Thank you.
Truly my
very
privilege.
much. We're
Thank
glad
you.
to share this with everyone.
Hi, Lona.
And we really appreciate that you would just kind of give us this really fascinating understanding of everything that's going on and all the good that's happening around it as well. So good thing.
My pleasure. I truly enjoyed it. Thank you.
Thanks.
Thanks, Wally.
We're going to put this where we recorded it, as we discussed earlier, and we're going to put this on our website and stuff. So hopefully more people will tune in and get this information.
All right.
So
Thank you.
Yeah. Glad
Stay
to
healthy.
always share good things.
Thanks, Wally.
All right. Good night.
have a good night,
Good
everyone.
night, everybody.
Thank you. Bye-bye.
Sorry we were late.
It's okay.
Yeah, me
Glad you
too.
came.
I was all set for 7:30.
That's all right. You'll be able to see the part you missed soon enough.